How to protect yourself from the coronavirus. In early 2020, a new virus began generating headlines all over the world because of the unprecedented speed of its transmission. The ailment caused by an infection with SARS-CoV-2 is called COVID-19, which stands for coronavirus disease 19. This infection caused by the novel coronavirus first identified in Wuhan, China, has been named coronavirus disease 2019, COVID-19. CO stands for corona, V for virus, and D for disease. Formerly, this disease was called 2019 novel coronavirus, or 2019 nCoV. In spite of the chaos and panic around world about this virus, you're unlikely to contract SARS-CoV-2 unless you've been in contact with someone who's confirmed to have the virus. Although COVID-19 is already characterized as pandemic, it is not an indication that the virus has become deadlier. Rather, it's an acknowledgement of the disease's geographical spread. There is an estimated 0.06 to 0.1% of people who developed the flu during the 2019-2020 flu season in the United States died as of February 2020, compared to around 3 of those with a confirmed case of COVID-19 in the United States. UNICEF has been preparing and responding to the epidemic of COVID-19 around the world, knowing that the virus could spread to children and families in any country or community. In this video, you'll learn how to avoid getting infected with COVID-19 virus. 1. Stay at home. Even if you don't have serious health conditions, and no symptoms, be extra cautious to protect other people. Obviously, some people don't have the opportunity of working from home, and people still need to venture out to grocery stores and gas stations. But when you can stay home, do so to flatten the curve. Staying at home can help your community and the world to avoid the further spread of coronavirus. 2. Social distancing. Avoid getting close to other people. The term social distancing means to stand or stay a meter away from other people. Health professionals believe that coronavirus travels through droplets, so limiting your vulnerability to other people is a good way to protect yourself. 3. Use your knees, feet, elbows and knuckles instead of your fingers. If you need to use an elevator to travel to the next floor, stop pressing elevator buttons with your fingertips. Anytime you have to open a door, push a button, pull a lever or digitally sign for something, use a different body part instead. 4. Wash your hands. The most overlooked way to prevent getting infected with coronavirus is washing your hands. Washing your hands correctly using soap and water and washing for at least 20 seconds or using hand sanitizer when soap and water aren't available, still stands as the best way to prevent the spread of infectious diseases. 5. Practice respiratory hygiene. Hygiene is a series of practices performed to preserve health. Hygiene refers to conditions and practices that help to maintain health and prevent the spread of diseases. Make sure you, and the people around you, follow good respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately because droplets spread virus. 6. Disinfect high-touch surfaces every day. High-touch surfaces cleaning and disinfection require the adoption of effective and proper executed protocols. Disinfecting high-touch surfaces daily may be hard. High-touch surfaces include things like light, door knobs, switches, drawer handles, television remotes, refrigerator and microwave oven doors, counters, toilets and faucets. Spraying high-touch surfaces with disinfectants promise to kill germs faster. You can also use antibacterial bleach to disinfect surfaces. 7. Boost your immune system. Feeding your body certain foods may help keep your immune system strong to avoid getting infected with coronavirus. The idea of boosting your immunity is enticing, but the ability to do so has proved elusive for several reasons. The immune system is precisely that, a system, not a single entity. To function well, it requires balance and harmony. Your body is better able to fight off illnesses when your immune system is really humming. Start daily activities and food choices that support your health and turn them into habits that will lead to lifelong improvements in health. 8. Wear N95 mask when going outside. Can wearing a medical face mask protect you against the new coronavirus? It's a question many people are asking. If it's a regular surgical face mask, the answer is no. A more esoteric mask, known as an N95 respirator, can protect you against the coronavirus. The N95 is thicker than a surgical mask and can prevent you from inhaling coronavirus from possible infected person. 9. Stock up on groceries, medicine and resources. Preparation is the best way to protect yourself and your family. Stock up on a 30-day supply of groceries, household supplies and prescriptions, just in case. But this doesn't mean you'll need to eat only noodles and canned goods. You should also feed yourself with fruits and vegetables to get the proper nutrients for your body. 10. Follow local public health guidelines. Many states and cities has implemented some guidelines for the public to follow. A lot of public and private schools are closed, and youth sports programs have been suspended. Shops, restaurants and bars are closed or have limited hours and capabilities, as do other non-essential businesses, such as clothing stores. If your state or local government has imposed guidelines, you should follow them to the best of your ability. 11. Stay calm. With the rising panic buying and depressing news about coronavirus, you should be cautious of your mental health as well. High stress levels can take a toll on your immune system, which is the opposite of what you want in this situation. If you're feeling overly anxious about COVID-19, follow these tips from a psychotherapist to keep your nerves calm. According to the World Health Organization (WHO), COVID-19 is now a pandemic, meaning a global outbreak of disease. On March 13, 2020, the President of the United States declared the COVID-19 outbreak a national emergency. If you develop fever, cough and difficulty breathing, seek medical advice promptly, as this may be due to a respiratory infection or other serious condition. Call in advance and tell your provider of any recent travel or contact with travelers. Why? Calling in advance will allow your health care provider to quickly direct you to the right health facility. This will also help to prevent possible spread of COVID-19 and other viruses. What are the precautions you do yourself in order to avoid getting infected with coronavirus? Let us know in the comments below. If you enjoyed this video, don't forget to subscribe to our channel. Give us a thumbs up, and hit that bell button to continually get updates from our channel.